All right, welcome, Happy New Year. It's an honor for me to introduce both Doctors Ries and Reznik, who are partners, domestic partners, married. There was just a great article in the Times about what do you call people, right, who are not married but have been together for a long time. They are married, but it should be one sort of universal term for people. So anyway, and this is the first time I understand that they've actually collaborated together on their August academic medicine paper, and will co-present today. Dr. Reznik is the UCSD Health Sciences Assistant Vice Chancellor of Faculty Affairs for the School of Medicine, Pharmacy, and Pharmaceutical Science, and an adjunct professor at California Western School of Law. She's also a pediatric nephrologist. She got her undergraduate and MD at Yale. She was in the first female class, and her MPH at San Diego State University. She's active in the Group for Faculty Affairs at the AAMC. She's published close to 200 articles and authored several textbook chapters. She's currently involved in research as part of a number of funded programs, such as the Hispanic Center for Excellence and the Comprehensive Research Center in Health Disparities that's funded by the NIH. She works on promoting women in academic medicine locally and nationally, has been a leader in designing programs and evaluating efforts to support women faculty. She's currently involved in research as a part of a number of programs that include I already mentioned, a pipeline program, which is the Hispanic Center for Excellence. She's the only child of immigrants and grew up in New York City, describes herself as a child of the city. She's been active in community building for San Diego County, and in addition, she's co-director of the UCSD National Academic Center of Excellence on Youth Violence. She's made a major impact in promoting gender equality in medicine, promoting junior faculty at UCSD, and in promoting the arts and culture within the community of San Diego. Dr. Ries is Professor of Medicine, Family and Preventive Medicine, and serves as the Associate Vice Chancellor of Academic Affairs and the Director of UCSD's Health Sciences Pulmonary Rehab Program. He's an adult pulmonary and critical care physician. He also got his undergraduate and medical school degree at Yale and his MPH from San Diego State University, and he's co-authored several books and many journal articles. He's also a member of the FDA's Medical Devices Advisory Committee's Anesthesiology and Respiratory Therapy panel, as well as the National Emphysema COPD Association's Medical Advisory Board, and on the Special Program Review Committee of the Medical Board of California. As Vice Chancellor of Academic Affairs, he oversees the recruitment, development, and advancement of outstanding faculty and academic staff at UCSD Health Sciences. His clinical and research interests include pulmonary rehab, chronic lung disease, and exercise physiology. We have a copy of their academic medicine article from August, and I'm going to turn them over to Dr. Ries first.
Thanks so much, Erica. It's a pleasure to be back on the East Coast. We both grew up in the East Coast. I grew up in Philadelphia, so New York's still a bit of a foreign country, but my roots are on the East Coast. We like to get our civilization fixed, so we're happy to be in New York. It's also nice to get a break from Southern California weather that we have. It's been really cold in San Diego. In fact, it's gotten so cold I actually had to put on a jacket the past couple of weeks. The difference between 40 degrees in San Diego and 30 degrees in New York is people in San Diego complain a lot when it's 40 degrees. But we really a pleasure to be here. Erica, asked us to talk about some of our experiences in developing a junior faculty development program in San Diego, and one that really Vivian has the major credit for developing and shepherding and institutionalizing in San Diego, and we have published some articles about it. We wanted to sort of tell you some of that story. As you said, we've both been in medical school, now health sciences administration. I've been involved for about 10 years. And one of the things I learned when I got into administration, things I was told that really turned out to be true, is if you look at the educational structure, administration in most medical schools, if you know one medical school, you kind of know them all. They're kind of all similar in somewhat different ways, but very similar. When it comes to faculty, what I was told, if you know how it works at one school, you know how it works at one school. And so to understand what we've done in San Diego, you have to understand a little bit about the culture and the structure and how our system works. And we have really just two offices, the Academic Affairs Office and the Faculty Affairs Office. academic affairs. I always describe this as the good, the bad, and the ugly. I've got the ugly part. University of California has a very extensive, robust, rigorous academic review process. All of our faculty undergo regular open academic review every couple years, and I get to oversee that, and plus all the appointments and other things. And Vivian gets the good and the bad. She does a lot of the faculty development activities, sort of helping and mentoring faculty. She also gets to deal with all the problems and complaints and misbehaving faculty. So that's kind of our overall structure. And what I wanted to do was sort of take you through a little bit of how we've approached developing an institutional programmatic approach to mentoring and helping our junior faculty. So clearly there are many challenges, particularly nowadays, for the growth and development of junior faculty. There are many professional responsibilities, particularly physicians, physician scientists have very complex job descriptions, not like we're part of a larger institution where we're sort of subject to the same rules, but our general campus faculty, basically have one job. They do research. We're a research university. Our faculty have many complex research, teaching, clinical work, various kinds of responsibilities. So they have complex job descriptions, and yet they're subject to the same requirements as all of the other faculty. Academic requirements can be very difficult if you're a physician scientist trying to develop a research program where your promotion depends upon developing a successful research program, and at the same time you're trying to develop your clinical expertise and clinical activities. It can be very difficult. Academic medical centers like ours are very complex structures. We have not just a medical school, we have several hospitals. We have our main hospital in 2 locations. We have an affiliated VA hospital. We have a children's hospital where our faculty are in different places. We have several different medical groups. So when faculty come into a structure like that, it's very often confusing and disorienting. Clearly, particularly physicians who are coming through training often have significant financial burdens, education debt, going through the up to 15 to 20 years of higher education and training to go into academic medicine can be very significant, accumulating significant debt. We are a state institution, but majority of our faculty are on soft funding sources, and so we act very much like a private institution. So our faculty are responsible largely for generating their own salary support. What I always tell them when we hire faculty is, well, we really give you is a title and a license, and that's about it for many of our faculty. So it's a real challenge for faculty to develop their careers and be able to support themselves. And for clinical faculty, there's a very strong law of private practice. I mean, why should you stay in an academic health system when you could make a lot more money and probably have a lot easier sort of structural life in private practice? So junior faculty are particularly vulnerable. If you look at data nationwide, the AAMC data, looked at the 10-year retention of assistant professors in academic medicine. It's only about 43% over the past couple decades. So as I said, UCSD is, I mainly talk about our own experience, and it is very much culturally dependent upon our own institution. UCSD is a relatively new medical school, founded in 1968, so we're still only about 45 years old. But we have had remarkable success and sustained faculty growth. Our faculty have doubled in size over the past decade. We've had a 160% increase. This is a sort of graph of our faculty growth, and you can see for at least probably the last nearly 20 years, it's been a straight line growth. We have had a net increase of about 50 faculty, salaried faculty a year over this time period. This increase bolus here was when we actually assimilated about 140 faculty from our children's hospital onto our salaried faculty. And in green here is actually the number of academic files that come through my office of the academic review process. And you can see we have almost 1,400 faculty now, and this year we'll probably be reviewing files of about 1,000 files coming through for an academic review of the faculty who are undergoing this regular academic review. So this is sustained growth, and it is challenging as the institution is growing, not just finding places and buildings and laboratories and offices for all these people, because we've had a lot of capital investments. It's a school that is still very much in a growth phase, in spite of what you hear about the state budget. Of course, as I said, we're not really a state institution in health sciences. But it is challenging for these faculty to succeed, given the fact that many of them recognize may not succeed. So as I said, we have a very formal academic review process. It's important to understand that as part of some of this article and some of the evaluation that we've done. But our faculty undergo this academic review process every 2 to 4 years. It's a very complicated, confusing process, often disorienting for junior faculty. But it has the positive benefit of it ensures feedback. There's no faculty member who goes through our system that doesn't get very active peer review process. Every 2 years, assistant professors are putting in their academic file. It can go up, it can be, there are up to 7 levels of academic review on our campus for those files, and faculty get feedback about how they're doing. We also, as a research university, have a strict 8-year probationary period. That means that our junior faculty, if you're hired as an assistant professor, you're on probation already when you start, and you have to be promoted in 8 years, and there's really no exception to that. So we have to ensure for success that our faculty are able to achieve promotion in 8 years. This is our, just sort of give you an idea of our complex academic ladder. These are our different ranks: assistant, associate, full professor. These are various steps. Typically, assistant professors go through 4 steps, step reviews every 2 years. Associate professors every 2 years, 3 steps. Full professors undergo a review every 3 years and then 4 years. If you're a full professor, it doesn't matter if you've won a Nobel Prize, you're still going to have your academic review. And in dark blue, these are actually career review promotions. So when you go from assistant to associate rank, associate to full professor rank, at step 6, and then above step 9, they stop numbering it. So actually, we just call those above scale faculty. Our faculty undergo this very extensive review, and it's all based on what you've done recently and how productive you have been. So that's why we have such a complicated process, but it also gives us access to data and very open data about information about how our faculty are doing. So I want to talk today about our faculty development programs, and clearly such programs have been developed to facilitate success and retention in academic medicine. They can be hard to establish. A lot of this depends upon the institutional culture, and as Vivian can talk about, there was some skepticism about whether this is a good thing for an institution. And I remember discussions. One of the reasons I was drawn into this was a number of our chairs felt that it really was not the institutional responsibility for mentoring junior faculty. It was really the responsibility of the chairs, the division directors who hire the people. That was their responsibility, and it was kind of stepping on toes for the institutional to develop such programs. And the questions, when one looks at evaluating, is this a good investment? Because it is an investment to have such programs. It takes a lot of investment in time and effort and money. One has to look at what are the benefits, and the benefits can be looked at in really 2 ways. Benefits to the institution, of our faculty do better or retain better, but there's also benefits to the individual, which may be very divergent from the benefits to the institution. And this can be difficult to evaluate. There's very little sort of quantitative literature in this area, and you basically ask the question, is it worth the expense or the expertise? I've, grew up in pulmonary medicine, worked a lot with doing clinical research with severe chronic lung disease, developed pulmonary rehab programs, and I can remember the same sort of arguments. It really, is this intervention really worth it? Should we be investing in it? Is it really cost effective to have whatever the treatment strategy is, whether it's rehabilitation or a surgical procedure or a new drug? It's the same kind of principles, and these can be difficult to evaluate, and yet you want some information to try to justify whether these kinds of efforts are appropriate. So with that, I'm going to turn it over to Vivian and let her talk about the development of our faculty development program, which is called NCLAM.
Which is not a title that you would use in any way, shape, or manner. But because we're a research university, you want to do this? Because we're a research university, if you want to do anything at our place, what they say to you is, if you can fund it, you can do it. So we're very entrepreneurial, and there was an announcement that came to the institution that there was funding available to develop a faculty development program. The dean sort of casually gave me the application and said, here, you do this. I don't think he thought very much about it at the moment he gave me the application, and what he didn't realize that there was an institutional match required for the program. And that institutional match has left us in perpetuity with this program. The title was picked by the Office of Women's Health, and there were 4 centers. I think we're the only one that's still in existence, and the idea was to establish a coordinated program to support junior faculty and MDs and PhDs through their initial years in academic medicine. It was initially written as a program for women, we got a call from the Justice Department that said you cannot use federal money to just promote a program for women, and that was the best thing that ever happened to us, because I think for such a program to succeed, you have to have men and women, because the issues are very, very similar, and in order to get the institution to buy into it, I think you're much better off doing a co-ed. And now the program is institutionalized, and it's funded by the Vice Chancellor for Health Sciences, and it sits in my office. For 10 years it sat in the Department of Pediatrics because it was my program, and when we finally became part of what the institution thought was an important piece, we moved it into an administrative office. So that the lesson is you can do it anywhere you want, as long as you have the idea and you have the funding and you have the support of your peers. So we had two sets of goals. One were goals for the junior faculty to increase their skills and knowledge, to design a personal academic strategic plan focused on the University of California. You've heard Andy describe how complicated the system is. No one tells you about it, no one really teaches it to you explicitly, so we thought that was an important piece. It does include a relationship with a senior faculty mentor, and to expand the network of colleagues within the university. We're spread geographically over a large area, and we have clinic sites all over the county of San Diego, and we have a VA, a children's hospital, and 2 medical centers. So people really don't interact. There's no place for them to meet each other and interact. But we also had institutional goals, and I think this is really important if you're thinking about developing such a program. For the institution, we wanted to have a formal mentoring for the junior faculty to enhance their connection to the institution. So our junior faculty, when they get to a place that's this complicated, often don't feel like they're very well connected to the institution. And one of our goals was to make them feel part of the institution and increase the sense of community for both junior faculty and senior faculty. This is our curriculum. It's a 7-month program. We have skill development. We have several sessions that talk about what does it mean to get promoted in our system, what are the elements of being promoted, how do you evaluate your excellence in both clinical research, university service. Every faculty member has to design a specific project that is in sync with their career goals, and then we have a group of very senior faculty who meet and look at those needs and assign a mentor, a senior mentor. The senior mentor is required not to be in their own division. So we're picking people outside of your normal sphere of influence, and the mentors are picked by their skill for whatever the project is. So if you want to do an education project, we pick one of our senior education faculty. If you want to develop a new program in the hospital, we look for people who have successful clinical programs and know how to do a business plan. So it's very specific, it's very short term, the mentors know that it's short term, and I think that's one of the reasons the mentorship piece works. We also pay a small amount of money to the departments of the junior faculty to allow them to free up some time. It's a very small, it's like a token, but it means that there is an institutional commitment, and we pay the senior faculty members $1,000 for being good sports. So this is our model. Mentoring, networking, understanding institutional culture. I think this is often missed when people talk about developing such programs. Every institution has its own culture, its own politics, and often junior faculty get into trouble not because they're bad doctors or they're not good research faculty, but they butt heads in the wrong way. They cross lines, they don't understand the power structure, they don't understand the political structure, and especially in this new age of collaborative science, you really have to understand the landscape where you work in. And we're a very collaborative institution, but that doesn't mean there aren't landmines. And so I think putting people in a room like this and having senior faculty talk with them and explain the culture to them really makes a difference. And I think it's often not paid attention to. And then obviously skill development, you know, becoming a better educator, writing a better grant, learning how to manage teams, conflict resolution, all the usual stuff. So that's sort of the model that we have used. But then we also wanted to know, is there a way we can evaluate whether we're doing any good? Because really that's what you want to know. So we wanted to know, what did the junior faculty learn in this program? Are they more confident as faculty members? Is the program cost effective? Because you have to be able to make that argument, I think, to the institution. And then for us, one of the key points was retention. At the time we started this, it was very clear people were leaving academic medicine. People were leaving our institution as well. And we didn't have a good sense of what we could do to stop that, because you can't change all of academic medicine. But we thought perhaps if we made people a little bit more comfortable with living in this world of academic medicine, they might stay. So, and then of course, did they succeed? So I'll show you some of the first studies that we did. We've been doing studies for this program's now 14 years old, and every couple of years we look and see for new methods. The original studies that we did were the first 4 classes and repeated it in 2005. And then we had a questionnaire that measured self-efficacy. We survey them yearly, so we know where all of our 230 faculty who have completed the program, we know where they are and what they're doing. And we got financial information from the institution. And Andy will be talking about the more sophisticated last 2 studies that we've done. So self-efficacy, for those of you that don't know, it's a term used in clinical medicine and psychology. It's a personal belief in your ability to carry out a behavior that produces an outcome. So you can use it in people's ability to manage chronic disease. In this case, we're talking about faculty members' self-efficacy, thinking that they can succeed in academic medicine. And we had a scale that we used. It's based on Carol Bland's study called Successful Faculty in Academic Medicine. It had 4 domains: professional development, research, medical education, and administration. And we looked at their confidence level before and after. So every class that comes in takes this assessment tool before, and then they take it when they completed the program. And we still continue to do this even today. And here are the results of the first 67 faculty. And as you can see, there was a effect in all categories. The smallest effect size was in research, because our research faculty are the most confident. They're picked because they've already demonstrated success. And the largest increase was in professional development, which is skill development, and administration, which is understanding your institution. Then the next question is, well, so they're confident. Are they more confident than junior faculty who've not been in our program? So we surveyed all of the junior faculty in 2000 and compared them to 39 of the graduates that we had. They were essentially very similar demographically, so there was no major difference. And here's the mean confidence scores for the NCLAM graduates and their peers. And you can see that there was improvement in all domains compared to faculty who had not done the program. Now, as we go further along, there's more spillover of the information we teach faculty in our program to other junior faculty, so I'm not sure we could repeat this with as good clarity as we did for this one. And then we asked the question, what's the return on investment for the program? And we just used the standard return on investment formula, total benefits minus the costs divided by the costs. And what we did was we took the cost of the program and compared it to the cost of recruiting a new faculty member after a faculty member leaves. So at this time, when a research faculty leaves, to replace them, there's an enormous cost up front. Probably at this time it was probably $500,000 to $1 million to replace that person with a new research lab and all the equipment you have to do. For a clinician, the upfront cost is not as great, but a clinician really doesn't perform up to speed for approximately 3 months. So there is a cost to the institution when faculty leave. And in this study, we showed that for every dollar that we spent, we got a $1.49 return. So there was evidence to the institution that it was worth investing in this program. So those are the arguments we made. The next question we really wanted to ask, is there a way of looking to see whether we've impacted the retention of faculty at our place and in academic medicine? And we didn't really have good tools. I can show you the data where everybody is, but that really wasn't a sophisticated way of looking at it. So we turned to our colleagues who were epidemiologists and asked them how might we go about doing this, and discovered that across the hall, Andy actually knew how to do this. So we asked them to help us design a study, and Andy Ries and Debbie Wingard are the 2 epidemiologists that really were the lead in this 2 studies that we have looking at retention.
Well, this part of the story comes under the category, if you have a hammer, everything looks like a nail. I'm pulmonologist by training. I've done most of my clinical research in patients with severe chronic lung disease, rehabilitation, lung reduction surgery, severe emphysema, and I'm trained in epidemiology really to help with that clinical research. And one of the things you learn about in dealing with those kind of sick patients is you get very comfortable with survival analyses. And so when I started hearing the conversations and the discussions and a lot of the skepticism about whether an investment in a program like this was really effective, it seemed to me, well, you're really talking about what we talk about in survival analysis. You know, do faculty survive in academic medicine? And if you want sort of some quantitative tools, if you look at the literature, it's very soft science. I mean, there's many times there's not even data, that there really might be a better way to sort of approach this. So we sort of took an initial jump at this and tried to see whether we could use some survival techniques. So we used some survival analysis techniques to evaluate whether faculty were retained in our School of Medicine and the effect of NCLAM, and using both Kaplan-Meier and Cox proportional hazards to look at some multivariate analyses. We didn't have really good data. I mean, if you go back, you know, we're sort of culling through index cards and files, and it's not like we have a lot of organized data, but we did have in our office, had some information back to the beginning of the school about basically some basic information about names of all the faculty we had hired over the last 30 years, when they were hired. We knew their gender, we knew their ethnicity, and we sort of classified them into URM or non-URM because we don't, again, have a lot of underrepresented faculty. We knew whether they participated in NCLAM. We knew if and when they left UCSD. And we decided when we sort of did our preliminary analyses that we'd have to censor, for looking at the assistant professors, we decided it was really most effective and made most sense to censor the date at 8 years. As I said at the beginning, we have an 8-year probationary period. If you're an assistant professors typically don't get recruited to go somewhere else. I mean, they typically come, they stay, they either succeed or they leave. And at 8 years, you're promoted. Now, the problem is that after 8 years, people leave for a lot of different reasons. Sometimes they leave because they didn't succeed, and sometimes they leave because they really did succeed and they were recruited somewhere else. So we thought if we really wanted to look at the effect of this program for junior faculty on junior faculty, we should cut our analysis at 8 years and let everybody go 8 years and basically see, did they stay at UCSD and did they get promoted? So if we looked at our data from 1988 to 2005, when we put this database together, we had 839 newly minted assistant professors. Over that time period, NCLAM in the first 7 classes had 120 faculty, which is about 1/3 of our assistant professors. NCLAM is not available to all faculty. There is an application. It's a bit competitive process. Faculty have to apply for it and we select them, so there is some clearly strong selection bias there. That the 120 NCLAM faculty included, we have faculty from all departments, MDs, PhDs, clinicians, all kinds of research faculty, 20 underrepresented minority, and there was clearly if anything, there is clearly, we have to admit, a selection bias in taking, because this did come from the Office of Women Health, and there was clearly in the selection, I think, a selection bias for women and minority faculty, recognizing that those faculty often have the most difficulty in succeeding in the world that we live in. So there were 67 of those were females. And we also had recognized that the NCLAM, as Vivian described, was established in 1997. So we had cohorts, we were able to look back at sort of the institutional experience before and after NCLAM came along. So here is the first article we published, looking at just sort of a straight survival analysis, a Kaplan-Meier plot. And what we have here is really 4 cohorts, and we sort of just divide these cohorts into about 4 or 5 year intervals based on when the faculty were hired. So the earliest cohort, which happened before NCLAM was established, is cohorts 1 and 2, and looking at the retention, or at 8 years in our institution of all those faculty. And then 2 cohorts which were hired after NCLAM was established, cohorts 3 and 4. And you can sort of see a couple things here. As I said, if you look nationwide, academic medicine, we're looking about, probably expected about 50% retention of junior faculty in academic medicine at our own institution. And so you can look at our experience based on the pre-NCLAM. It was about the same. It was about, at 8 years, we had about 50% of our faculty were promoted and still at our institution. And you can see that sometime around the time, something happened in the time where NCLAM was established, where we have about a 10 to 15% better retention of faculty in our institution at 8 years in the 2 post-NCLAM cohort, suggesting that maybe NCLAM was having an effect, although that may not be the only reason, because there are a lot of changes as this young institution grew over that period of time. We also looked at just a straight comparison of NCLAM versus non-NCLAM participants, taking everybody over this time period, whether they were in the program or not in the program. And again, you can see consistently that the retention of the NCLAM participants on our faculty was about 10 to 15% greater, and was statistically significant. You looked at the predictors. We then looked at the Cox models and looked at predictors of survival, of retention, based on whether on the data that we had, and clearly the strongest predictor of whether they were still on our faculty at 8 years after they were hired was whether they participated in NCLAM. But there was also a strong effect, a significant effect of their hire date, and you can sort of see that in the trends. The faculty who were hired later, as this cohort matured, had a greater retention rate. There was no significant influence of either gender or on ethnicity, and that was in the univariate models, just looking at each independent variable on its own. If you put them in a multivariate models, put all of the covariates in together, then NCLAM, they're not quite statistically significant, but clearly NCLAM is still the strongest effect. Higher date is somewhat significant. And again, gender and ethnicity appeared to have no effect. And that's really been our experience, that, as Vivian said, this program is equally effective for women, minorities. It really is issues are different, but the kind of issues are the same for all types of faculty. So the conclusions from this initial study was that survival analyses seemed to be useful techniques in assessing this problem of faculty retention. It suggested a positive influence of a faculty development program on the retention of our junior faculty, but clearly there was also other factors that might be contributing. There were temporal influence, changes in the institutional climate as it developed, and contemporary differences, that the NCLAM and the non-NCLAM participants weren't necessarily all there at the same time, and the faculty who were selected are maybe quite different. But there appeared to be no effects of gender or ethnicity, which is one particular area that we were interested in. Although recognizing that women and underrepresented minorities were probably overrepresented in NCLAM. And you could, historically, these faculty had poor retention rates. And that was one of the rationales for starting this program, was to really facilitate success for women and minority faculty. And the fact that that it was not different might suggest that in fact the program was having a positive effect, in that they actually weren't doing worse than the other faculty. So again, the fact that there wasn't a difference, might even suggest that it was having an effect, but it's hard to prove equivalence, an effect where it's equivalent. Clearly there were some limitations, as I said, that survival analysis assumes that retention is a positive outcome. That depends upon whether it's the institution or the individual perspective. Successful faculty development, this was our experience. Someone gets into NCLAM as a junior faculty and you realize very early that this is not the right place for you. You're not going to succeed. You're a clinician, you want to do different kinds of things, or you're a researcher. Once you realize the rules of the road, maybe this is not the right place for you. In fact, faculty get into the program and then bail out very quickly. And that might be bad for the institution, but maybe that's a good thing. If you talk to the faculty, that was actually a good thing. They actually learned early that this was not going to work out, and they took another career path. You help people transition earlier, which might be good for the institution, for the individual, not for the institution. So as I said, there's a very difference in depending on what your perspective is. This is clearly a retrospective analysis. We only had the available data, and we didn't really have any good systematic information about why people were separating. And as I said, there's likely a selection bias for who comes into NCLAM. So we took on this is our most recent article, so we decided to take this a little step further, using the same data. This was just published this year in Academic Medicine. And we wanted to sort of be able to, although clearly we're never going to do a randomized study, we weren't going to be able to take faculty and randomly allocate them to a junior faculty development program. There are a lot of reasons why some faculty want to do it, or some department chairs want their faculty to do it, and other department chairs don't want their faculty to do it. So we decided to look at our database and actually do some matching and match pair analysis to control for some of these other variables in the climate. Controlling for when they were hired, their academic series. At UCSD, we actually have 10 different faculty titles. We have, in our salaried series, we have 5 different tracks. They have 5 different titles. You can't, tell, without a scorecard, you can't tell who's who. But we have some tracks that are really geared for more research faculty and some for clinical faculty, and it's a very confusing system. And so obviously, we were comparing a lot of this as apples and oranges comparison. So we wanted to control for the particular academic track and series that faculty were appointed in, assuming that influenced if we were going to make a valid comparison. We also wanted to control for which departments they were in, because if you're, what's influencing a surgeon or an internist or a basic scientist could be very different. And so we wanted to control for some of their issues related to differences in primary job responsibility. So we took each of our NCLAM participants in the first 8 classes, and we matched them with 2 non-NCLAM participants from our database that were matched in order of priority, that they were number 1, the same gender. They were in the same series, that is, where they primarily are research or clinical faculty. Their initial step, I showed you our step, so we wanted to get people who, and that has to do with where they're hired, has to do with their level of seniority when they're hired, and whether they're entry level or above entry level. So we wanted to control for their initial step at their hire, when they were hired, and which department they were hired in. And we did Kaplan-Meier log rank comparisons of our matched sets, again censored them at the end of 2006, and looked at our univariate effects of our various covariates. And we also did some multivariate analyses as well, and used an interaction term essentially to look at the relationship, the interaction of whether they were NCLAM and whether there was an interaction of gender and underrepresented minority status. That is, whether that the NCLAM was having a differential effect, a greater effect on the women and minority faculty. So, looked at our first 8 classes, and we had 122 assistant professors, and we were able to identify 2 matches for 89 of them, 1 match for 24, no matches for 9. And we did this match pair analysis where we had 113 NCLAM faculty, 202 non-NCLAM faculty, and again recognizing we had more underrepresented minority faculty in the NCLAM versus the non-NCLAM matches. Again, suggesting what we already thought, which is there was a bias in selecting faculty. Here's our survival analysis. Looks kind of similar to the other one. It's not as strongly positive, but again, we have, looking at, these are matched pairs now of the NCLAM, non-NCLAM faculty. Again, about a 60% retention of our matched non-NCLAM participants, a little better than we had before, just our sort of unmatched. But again, comparing in the matched pairs, at about a 10% better retention of our faculty who participated in the junior faculty development program. The other thing we thought we might be able to look at, because of this very complicated open academic review process everyone goes through, is not only are we retaining faculty, but are they more successful? I mean, that's the other reason. It isn't just how long you live, but it's the quality of your life. So the question is, so we have a lot of data on our faculty. It was in paper records. And when you submit your file every couple years, you have to, it's very clearly stated, and people comment on this, about what are you doing, your accomplishments in research and scholarship and teaching and university and professional service and clinical activity. Are you a good doctor? I mean, a lot of that information is accumulated in your dossier as it goes forward. And so we decided to sort of try to mine these data, and we created, after some testing, some 5 categories of what we considered academic success. We had 2 reviewers independently go through the files on some of these faculty and try to classify their records based on these 5 areas. One was leadership and professional activities. Did they assume administrative positions? Were what their committee service? Were they on grant review committees, editorial boards of journals? 2 was, had they received honors in various awards? 3, contracts and grants. Were they PI or co-investigator on various contracts and grants? Teaching and mentoring, were they course directors, the number of mentees and advisees that they had, and then obviously the publication, sort of counting their bibliography. So we took each of the NCLAM participant for this match pair analysis. We did that a little different than the previous one. We took each NCLAM participant from the first 5 classes. We only took 5 classes because we wanted to allow sufficient time to sort of be able to evaluate academic success, which would take longer than just a few years. And so we identified each of the NCLAM participants in the first 5 classes who was still at UCSD when we closed the analysis, which was at the end of 2009. That is, they were still on our faculty. And we matched them with one. We can only find 1 matches. We didn't have many matches, but we took 1 non-NCLAM participant who was also still on our faculty at 12/31/09, using the same matching strategy. So they came in at the same time. They looked similar at the beginning in terms of what we could identify. And in 2009, they were still on our faculty. They hadn't left. So they were both successful groups. And so we had, of our NCLAM participants, 59% of the 79 were still at UCSD, sort of what we would expect. And we were able to identify matches, one-to-one matches, only for 29 of these. So again, this is a limited, it's a small data set, so it's fairly preliminary kind of study. But we wanted to see if we could see anything different about these two groups of faculty. And so it's a small data, a lot of non-normal distributed, so we did sort of a non-parametric approach to this and just sort of counted up in these different categories, the numbers in these different 5 categories of success, and just said what's the difference between these two pairs, and compared them with box plots and just did some non-parametric comparison. And so here's our box plots from the article. And if you're not familiar with box plots, it's just a nice convenient way of graphically showing the distribution of data. The boxes show you the percentiles. The upper and lower part of the box is the 25th and 75th percentile, and the bar across the middle is the median, so it just shows you the distribution. The whiskers, which are the extensions, show you something about the distribution of data around that, and then you identify any of these individual dots are just outliers that are outside of that. And so above 0 just means that the NCLAM participants had more in those categories than the non-NCLAM, and below 0 means that they were less. And you can see that the trend, and the 2 dotted lines identify the points of statistical significance at 0.05. So what you can see is, number one, that all of the 5 categories, the NCLAM participants overall had higher numbers than the non-NCLAMs in all 5 categories. Only in one category was it statistically significant, and that was of interest to leadership and professional development. So our conclusions from these analyses were, we thought that these sort of confirm and strengthen the evidence of benefits of this organized, institutionally based junior faculty development program on retention. The match sets controlled for some of the variables I mentioned. And then compared with successful, now just comparing successful faculty, compared with our non-NCLAM participants, there's a consistent trend of greater academic success, but only for the leadership and professional activities were they significant. Selecting a comparison group of successful faculty may bias the results against the program, because we're already selecting people now they're still successful. You know, not everybody needs a faculty development program to be successful. And so, and many faculty and some of our chairs say, well, the people don't need it. They have access to their own mentors. You know, they already are on board. We're already helping them. They don't need this sort of organizational support. So we're selecting really against the effect of the program, because we're looking at people who are inherently successful. Although one can argue that an organized program might have its greatest effect on the faculty without those strong institutional or department support networks for them. So again, there's some selection of who actually we take in. And being on the selection committee, we have a group of senior faculty who select people for the program. Some of that does go into play. You know, we don't take people, if they look like they're already successful and they're already ready to be promoted, we sort of look and say, well, is this person really going to benefit versus somebody else who's really starting out and really needs some help? And so that does come into play. And leadership and professional activities, as Vivian's described the program, you might expect that this might be one area where the program might have its greatest influence. I mean, if you're a research faculty and you've been successful, you're likely to have grants and publications and be on committees and that type of thing. And yet this is an area, sort of the institutional culture, understanding the institutional culture, being invested in the institutional culture, participating in leadership might be something that if faculty feel more bonded to the institution, they may actually do better in. And so that wouldn't be unexpected. So in summary, I think we've sort of told you the story of the development of our faculty development program for junior faculty. We think that we've got some evidence that it does improve their skills and confidence. We think there's some evidence that it's cost effective, hard to do those kind of studies. We do strongly believe now it does improve faculty retention. We don't hear from the skeptics. In fact, interestingly, when the program started, Vivian didn't mention, but it's open. We always try to have faculty from all departments. We actually only have now 16 departments. UCSD was uniquely founded with only 12 departments, and so we have now up to 16. But we always wanted to have faculty from all departments, all different series, but not all departments and chairs were equally supportive of it. And there was a number of years where some of our departments wouldn't send anybody to these programs. And now I can say that we can say pretty well that pretty much all the departments participate. There's very little skepticism if you look at the conversations in the central administration about the benefits. And a lot of it is, it's really the testimonies from the faculty who are now matured in our system, who are really strong supporters of this program and are very bonded to the institution and feel very passionately about the program. And I think it's helped to change the institutional culture. So we do believe that the program has improved intention, and both in our institution and in academic medicine, recognizing that some of our success benefits other institutions as faculty get recruited elsewhere. And there's some evidence, although not strong, that we're facilitating academic success. And with that, I think we'll close and be happy to take any questions or comments or criticisms. Thank you.